She was 75 when she came to see me about her neck. She had been living with a dull ache across the back of her neck and into her shoulders for about 6 years. She had tried heat, she had tried creams, she had a drawer full of pillows that had not worked. And she told me she had started cracking her own neck several times a day because it gave her a few minutes of relief. I want to talk about that last part because I asked her to stop, and I want to explain why. Then I'm going to teach you the technique that actually helped her. It takes about 2 minutes. It requires nothing but a wall or a bed, and it targets a set of muscles that most people have never heard of and almost everyone over 60 has neglected. Let me start with the anatomy because this is the part that makes it click. Your head weighs roughly 10 to 12 pounds. That's about the weight of a bowling ball, balanced on top of a flexible column. Now, here's what matters. When your head sits directly over your shoulders, that weight is carried efficiently by the bones. When your head drifts forward, even by an inch or two, the muscles at the back of your neck have to hold it there. They are working constantly all day against gravity. And here's where it gets specific. You have 2 layers of neck muscles. The outer layer, which you can feel, includes the big superficial muscles that turn and tilt your head. Underneath those, sitting right against the front of your spine, is a deep layer called the deep cervical flexors. Those deep muscles are not movers, they are stabilizers. Their job is to hold your neck segments in position so the outer muscles can do their work. Research on people with chronic neck pain has consistently found the same pattern. The deep stabilizers become weak and slow to activate, and the superficial muscles take over, doing a job they were not designed for. That is why the outer muscles feel tight and sore. They are not the problem. They are compensating for the problem, which explains something a great many of you have experienced. You massage the tight muscles, or you stretch them, or you crack the joint, and it feels better for 20 minutes. Then it comes back because you treated the compensation and not the cause. So here's the technique, and physical therapists call it the chin tuck or cranial cervical flexion. There are 12 randomized controlled trials in the systematic review literature on this method for neck pain. It is standard practice in physiotherapy clinics worldwide. Let me teach you the lying down version first, because it is easiest to learn correctly. Lie on your back on a bed with a small flat pillow or a folded towel under your head. Knees bent, feet flat. Now, without lifting your head off the pillow, gently nod your chin down toward your throat. The movement is tiny. It is the motion you would make if you were saying yes very slightly, or the motion of gently making a double chin. You should feel a mild tightening deep in the front of your neck. Hold that for 10 seconds while breathing normally, then release completely. Repeat 10 times. Now, 2 mistakes to avoid, and almost everybody makes them at first. Do not lift your head off the pillow. If you are lifting, you have switched to the big superficial muscles, and you are practicing the exact pattern you are trying to correct. And do not push hard. This is not a strength exercise. It is a control exercise, teaching muscles that have gone quiet to switch on again. Gentle and precise beats, forceful every time. Once that feels comfortable, you can do the standing version. Stand with your back against a wall, heels a few inches out, head touching the wall if you can manage it comfortably. Gently tuck the chin, sliding the back of your head up the wall slightly. Hold 10 seconds, release, repeat 10 times. Twice a day is a reasonable target. Now let me be honest about the evidence, as I always try to be. The research shows this training improves deep neck muscle endurance, reduces pain, and improves neck disability scores. But a randomized trial published last year found that a different approach, the McKenzie method, produced comparable results. Both groups improved significantly across all measures over 6 weeks, with no meaningful difference between them. So I am not going to tell you this is the one magic exercise. What the evidence supports is that specific, consistent neck exercise works. Several methods work. Doing nothing does not. 6 weeks is roughly the timeline in these trials, so please do not judge it after 4 days. If this is useful to you, tell me in the comments how long your neck has bothered you. I read them. Now, the part I asked you to stay for. Why I told my patient to stop cracking her own neck. Running up through the small openings in your neck vertebrae are the vertebral arteries. They travel from your upper chest through the bones of your neck, loop around the top vertebra, and enter your skull to supply the back of your brain, including your brainstem and cerebellum. They are anatomically vulnerable in that path. Forceful rotation or hyperextension of the neck can tear the inner lining of one of those arteries. That is called a vertebral artery dissection. When that lining tears, a clot can form at the site and travel into the brain, causing a stroke. The medical literature contains case reports of this following forceful neck manipulation, including reports following self-manipulation. One published forensic case describes a previously healthy man who cracked his own neck at work, developed neck pain, then stroke-like symptoms, and died of bilateral vertebral artery dissection. Now, I want to be fair and accurate here because this topic generates more heat than light. Cervical artery dissection is genuinely rare, at roughly 3 to 4 cases per 100,000 people per year. Most cases happen spontaneously, with no manipulation involved at all. And there is a real difficulty in establishing cause because neck pain is often the very first symptom of a dissection that is already underway. Which means some people seek out neck manipulation because a dissection has already begun. That is a legitimate scientific objection, and I am not going to pretend it away. So here's my honest position. The absolute risk is low. The benefit of the crack is temporary and does not address the underlying problem. And the worst outcome is catastrophic and irreversible. Given that trade, I ask my patients not to do it, and I would ask you the same. If you choose to see a manual therapist, that is your decision. And many people find manual therapy helpful. I would say 2 things. Tell them your full medical history, including any blood thinners, connective tissue conditions, or history of stroke. And there are gentler mobilization techniques that do not involve a high velocity thrust, which you are entitled to request. Now, the symptoms that mean you stop everything and seek emergency care. Sudden severe neck pain or headache, unlike any you have had before, particularly at the back of the head. Dizziness, vertigo, or unsteadiness that is new. Double vision or visual loss. Slurred speech or difficulty finding words. Numbness or weakness on one side of the face or body. Difficulty swallowing. Or a sudden loss of coordination. Those are the warning signs of a dissection or a stroke in the back of the brain. And they can appear hours or even days after a neck injury. And separately, some neck symptoms are never an exercise problem. Weakness, numbness, or tingling running down the arm into the hand. Any change in hand dexterity, like dropping things or struggling with buttons, changes in walking or balance, any bladder or bowel changes, those can indicate pressure on the spinal cord itself, which is called cervical myelopathy, and it needs prompt evaluation rather than stretching. Neck pain with fever or with unexplained weight loss or a history of cancer also needs proper assessment. 3 honest statements before I close. 1, patient's improvement is a story, not evidence. The exercise evidence supports consistent neck training in general rather than one uniquely superior method. And this video is education, not medical advice. I am a physician, but I am not your physician. And if you have significant neck pain, you should be assessed rather than self-treating from a video. Here is what I would leave you with. My 75-year-old patient did not need a machine, a pillow, or a supplement. She needed to stop doing the thing that gave her 20 minutes of relief and start doing the small, boring, unglamorous thing that took 6 weeks. That is most of medicine, honestly. The dramatic fix is usually the one to be careful of, and the tiny movement you can barely feel is usually the one that lasts. Tell me in the comments whether you have ever cracked your own neck. I ask without judgment because almost everyone has, and almost nobody has been told what I just told you. Take care of yourselves, and I will see you in the next one.